A 28-year-old female presents in your outpatient department and she's pregnant for the first time. She presents for her routine checkup. While performing her anomaly scan as recommended by the gynecologist, the sonologist finds that the pelvic measurements, specifically the subpubic angle, is less than 90 degrees, indicating a contracted pelvis. This basically helped a lot in the management of the case, which included planning a C-section instead of a normal vaginal delivery, which was impossible in this anatomical variation of the pelvis. So, what is the normal anatomy of the pubic bone? Why is this bone so important? And why was this subpubic angle so important? Let's jump into the details of the pubic bone to get a better understanding. The pubic bone is one of the bones that make up the pelvis. It is ventral and anterior. It is covered by a layer of fat, and we have a very important joint over here which is formed by the union of two pubic bones known as the pubic symphysis. Now, the pubic bones have very important functions to perform, such as protecting the intestines, urinary bladder, and the sex organs. Apart from this, it also acts as a connection between the torso and the lower limbs. That is the reason it allows a variety of movements to be performed by the hip joint. Although it seems to form not a very mobile joint, but still, it also has some motor functions to perform, as it also stabilizes the pelvic girdle during different movements. The innervations to the organs within the pelvic girdle are also lying in close relation to these pubic bones. So any injuries affecting these bones can cause neuronal damage. There are a lot of anatomical variations that exist in case of pubic bones. This can be the distance between the pubic symphysis and the insertion point of the hip. So that is different for different individuals. Even we'll be discussing that the angles that the pubic arch makes is different in males and in females. The length of the pubic symphysis may vary in different individuals as well. So now we know that it is very important to study the anatomical details to this somewhat small pair of bones forming the pelvic girdle. Again, there are a lot of anatomical variations that can produce clinical conditions in individuals too. I'll be detailing a lot of muscle insertions, cartilages, ligamentous attachments, and tendons. All of these structures allow for the formation of joints. Now we'll be discussing the pubic bone in three parts: the body, the superior ramus, and the inferior ramus. As for the body of the pubis is concerned, it is somewhat flattened and has a superior border which is called the pubic crest. Then laterally it has this distinct pubic tubercle, which is an important landmark. We must appreciate over here that the upper portion of the pubic bone is contributing towards 1/5 of the acetabulum, which is this cup-shaped structure. For the study purposes, it has three surfaces: anterior, posterior, and a medial one. Now coming to the anterior surface, it is rough superiorly and elsewhere it is smooth. The posterior surface is also known as the pelvic surface. It is basically forming the anterior wall of the true pelvis. It is closely related to the urinary bladder. Finally, we have this medial surface. It is also known as the symphysial surface because it articulates with the opposite pubic bone to form the pubic symphysis. You can consider it to act like a lock in the cage of the bony pelvis. Now coming to the handle-like portion of the pubis, which is the ramus of the pubis. It has three borders and three surfaces. Now coming to the superior border, it is also known as the pectineal line, as shown here. It is forming the pubic part of the arcuate line that we've already discussed. The inferior border is quite sharp and forms the upper margin of the obturator foramen. The anterior border is called the obturator crest, as shown here. The three surfaces are first of all, the pectineal surface, which is triangular, and it lies between the anterior and the superior borders. From the pubic tubercle, which is a raised tubercle, as you can appreciate over here, and then we have this iliopubic eminence, which is a raised ridge at the junction of the ilium with the pubis. Now coming to the pelvic surface, it is present between the superior and the inferior borders. It's mostly smooth and is continuous with the pelvic surface of the body of the pubis. The obturator surface is lying between the anterior and the inferior borders and is presenting this obturator groove over here. Now coming to the inferior ramus, it extends from the body of the pubis to the ramus of the ischium, as you can see here. It unites with the ramus of the ischium to form the ischiopubic rami. Now this ischiopubic ramus formation is clinically very important. The subpubic angle is a very important angle formed between the inferior borders of the ischiopubic rami. The subpubic angle is a very important angle formed between the inferior borders of the two ischiopubic rami. It is almost 90 degrees in females and 50 to 80 degrees in males. So it is a kind of an identification feature in sex determination, but there are anatomical variations that exist, as we even saw in our case study, that the female that came up to the OPD was suffering from a contracted pelvis. So it was hard to carry out a normal vaginal delivery in that particular case. You must remember that a normal female pelvis which is most suitable for a childbirth is known as a gynecoid pelvis, or even an anthropoid pelvis can be considered suitable for a normal vaginal delivery. But the other varieties, including the platypoid and the android varieties, are a type of contracted pelvises. They do not support normal vaginal deliveries and are an indication for the C-sections as we saw in our patient initially. Now let's get into the details of the muscular attachments found on the pubic bone. The lateral part of the pubic crest gives attachment to the lateral head of the rectus abdominis and also to the pyramidalis. Rectus abdominis is this sheet-like muscle which can be transformed into the famous six-packs if you do your workout religiously. Origin to the adductor longus is between the crest and the symphysis. Coming to the inferior ramus, we find here the origin to the adductor brevis, which is lateral to the origin of the gracilis muscle. These are basically the major adductors of the lower limb. And finally, we have the origin to the obturator externus, near the margin of the obturator foramen. The pubis also gives origin to the obturator internus, a bit laterally. As you can observe, the origin of this muscle is extending over the ischium all the way to the ilium as well. Then the pubis also gives origin to the obturator internus, a bit laterally, as you can observe. The origin of this muscle is extending all the way over the ischium, including the ilium as well. The posterior surface of the body of the pubis provides origin to the levator ani. Levator ani is one of the chief muscles forming the pelvic diaphragm. As you can see, it is a sheet-like muscle. Pectineus muscle gets attached here along with its covering fascia. It is the most anterior adductor of the thigh, but its primary function is the hip flexion. To help you remember all these muscles, I have a little story to tell. Imagine a little girl playing on her roof and suddenly she had a fall, which results in her hip bone fracture. So this short story will help you remember the muscle attachments on the pubic bone. So let's get started. So the mnemonic is a little girl playing on roof. The A over here stands for adductor brevis and adductor longus. The L stands for levator ani. The G for the gracilis muscle. P for the pectineus muscle and the pyramidalis. The O stands for obturator internus and obturator externus. Finally, the R stands for the rectus abdominis. So these are all the muscles that gets attachment to the pubic bone. Now coming to the ligamentous attachment, the pectineal line provides attachment most importantly to the conjoint tendon towards the medial end, then the lacunar ligament at the medial side and the pectinate ligament along the whole length. Now, all of these ligaments are present bilaterally, but for your ease and your understanding, we have shown some of them on the right and some of them on the left side. The pubic tubercle gives attachment to the inguinal ligament. The anterior surface of the body of the pubis provides attachment to the anterior pubic ligament on the medial surface and to the posterior pubic ligament posteriorly. To help you remember these ligaments that gets attachment to the pubic bone, we have a mnemonic LIP. Now this short mnemonic is going to help you remember the ligaments that gets attached here. The L over here stands for the lacunar ligament, I for the inguinal ligament, P for the pectinate ligament, posterior pubic ligament, and the anterior pubic ligament collectively. Now you must remember the important relations and the important structures that are lying in close proximity to the pubic bone. The pelvic surface of the pubic bone is crossed in males by the ductus deferens and in females by the round ligament of the uterus. The functions of the obturator groove over here is to transmit the obturator vessels and nerves. So in case of any trauma or any injuries, all of these structures can be damaged. I hope you're now well versed with this particular pubic bone.